Very good morning to our respected Professor Dr. Zainal Arifin. My name is HAASHVITHA, daughter of HARINATHRAO, and my matrix number is BM24110033. I am excited to share with you my passion for pursuing a career in medicine, specifically as a pediatrician. Hence, today I will present about pediatrician and the disease related to the specialty. Before I continue, let me start with a brief introduction regarding pediatricians. Pediatricians are doctors who specialize in treating children. They help prevent, diagnose, and treat diseases in children. In addition to general pediatricians, there are also pediatric subspecialists who focus on specific areas of medicine, such as pediatric cardiology, pediatric endocrinology, pediatric oncology, and pediatric hematology. And today, I'll be focusing more on pediatric hematologies. Now, let's continue with the anatomy of bone. Why the anatomy of bone? Because the disease that I chose is related to the bone marrow, which is located within the bone. The bone is made up of compact bone, spongy bone, and bone marrow. Compact bone is the outer layer. Meanwhile, the spongy bone is mostly found at the ends of bones and contains red marrow. Bone marrow is found in the center of most bones and has many blood vessels. Red marrow is involved in hemopoiesis, the blood cell production, and has blood stem cells that will become red blood cells, white blood cells, and platelets. Yellow marrow is mostly fat and is found in the central cavities of long bones and act as an energy reserve. Now, let's continue to the physiology of bone marrow. There are three. Firstly, bone marrow is the site of hemopoiesis where blood cells are produced. There are two types of hematopoietic stem cells, which are common myeloid progenitor cells and common lymphoid progenitor cells. These common myeloid progenitor cells and common lymphoid progenitor cells, they further differentiate into specific progenitors that will develop into matured blood cells, such as erythrocytes, neutrophils, or platelets. The final differentiated cells will leave the bone marrow and enter the bloodstream. Now, on to the second one. Produce lymphocytes which carry out immune responses. There are three types of lymphocytes, which are B cell, T cell, and natural killer cells. So B cells are produced and matured in bone marrow and they destroy bacteria toxins. T cells, they are produced in bone marrow but they are matured in thymus and they attack viruses, fungi, and cancer cells. And lastly, natural killer cells. They are important for recognizing and killing infected or cancerous cells, but they do not require antigen-specific receptors like B or T cells. Lastly, it is important for the regulation of bone health, where they help in bone resorption and bone formation. Now, onto the disease that I chose, which is childhood acute lymphoblastic leukemia. This is due to uncontrolled proliferation of abnormal lymphoblasts in the bone marrow. These immature white blood cells can spread to lymph nodes, spleen, and liver. These are the few examples of symptoms: looking pale, painless lumps, shortness of breath, bone or joint pain, or abdominal pain. How do we diagnose this disease in a child? There are two ways. The first one is complete blood count, CBC. Blood is collected by inserting a needle into a vein and allowing the blood to flow into a tube. The blood sample that is taken is then sent to the laboratory and the red blood cells, white blood cells, and platelets are counted. The second one is bone marrow aspiration and biopsy. After a small area of skin is numbed, a bone marrow needle is inserted into the child's hip bone. Samples of blood, bone, and bone marrow are removed for examination under a microscope. There are two treatments that can be used to treat this childhood acute lymphoblastic leukemia in a child. So the first one is CAR-T cell therapy. This treatment changes the patient's T cells so they will attack certain proteins on the surface of cancer cells. T cells are taken from the patient and special receptors are added to their surface in the laboratory. The changed cells are called chimeric antigen receptor (CAR T cells. The CAR T cells are grown in the laboratory and given to the patient by infusion. The CAR T cells multiply in the patient's blood and attack cancer cells. Other than that, we can also use stem cell transplant, where it is a treatment to replace the blood-forming cells. Stem cells are removed from the blood or bone marrow of a donor and are frozen and stored. After the patient completes chemotherapy and radiation therapy, the stored stem cells are thawed and given to the patient through an infusion. These stem cells grow into the body's blood cells. The donor stem cells may also find and kill any cancer cells left in the body. Stem cell transplant is rarely used as initial treatment for children and adolescents with acute lymphoblastic leukemia. It is more often used as a part of treatment for acute lymphoblastic leukemia that relapsed. So the first step in stem cell transplant is blood is taken from a vein in the arm of the donor. The blood flows through a machine that removes the stem cells. Then the blood is returned to the donor through a vein in the other arm. Step 2. The patient will receive chemotherapy to kill blood-forming cells. The patient also may receive radiation therapy. And the last step is the patient receives stem cells to a catheter placed in a blood vessel in the chest. Now, a specialist in pediatric field that I look up to is Dr. Benjamin Spock. He emphasized the idea that children's emotional and psychological needs were as important as their physical care. The importance of allowing children to express themselves and make choices within the context of appropriate guidance, as well as understanding their individual developmental stages. Other than that, he also emphasized better mental health support for children, especially in the aftermath of traumatic experiences. And also holistic pediatric care that considered not only the physical health of children, but also their emotional and psychological needs. He also emphasized on parent-child bonding. In addition to advocating for a flexible routine, Dr. Benjamin emphasized the importance of the parent-child bonding. His advice was grounded in psychological research, showing that a strong, affectionate relationship between parents and children was crucial for emotional development. He suggested that children should not be subjected to excessive discipline or control, but rather should be nurtured with affection and understanding. In conclusion, I want to become a pediatrician because I am deeply passionate about making positive impact on children's life. The opportunity to combine my interest in medicine with my desire to support and nurture young people is incredibly fulfilling. Pediatric care allows me to not only treat physical ailments but also guide children and their families through developmental milestones and emotional challenges. By working in pediatrics, I can help foster healthy, happy futures for children and make a meaningful difference in their overall well-being. And that's it from me. Thank you.